I think I'll go ahead and get started with introductions. Go ahead, introduce yourself and tell us if you've got any updates that you'd like the group to know. And I'll start with Chief McKern.
There we go. Tim McKern, Cool Scene Fire Rescue and South End.
Thank you. Dana Markland. I didn't know who you were. I'm sorry.
No worries. So I am the new person working with Kelly at L360, Kelly Parcher.
Great. It's good to have you here. Anything going on there at the Piper?
Well, lots of construction, and we just got the flooring yesterday, so we're just getting more excited by the minute.
That's very exciting.
Mm-hmm.
Chief Olson. Or Dr. Carlbaum.
David Carlbaum, Medical Program Director for East Jefferson County, which means supervising the pre-hospital care of patients by law enforcement, the dispatchers, and the firefighters. I work for Chief McKern and Chief Black.
Is there any highlights you want to tell us from the summit? I know that happened since folks left.
I'm kind of blanking out about that. Can you help me remember if there's anything in particular?
I know there was. Go ahead.
Oh, there was one thing, and that is great presentation by Jefferson Healthcare around kind of a lot of the internal processes and challenges and opportunities they have when dealing with behavioral health patients, which are a lot of challenges. And one thing that came out of that meeting was the desire to have a quarterly case conference talking about either high utilizer patient or particularly challenging patient with all the parties that were involved in caring for that patient.
That is exciting, particularly because it's one of the things that we hoped to accomplish in the 3 years of having the consortium together. So good step in the right direction. Patrick Johnson.
Yes, thank you. Hello, everyone. I'm with NAMI Jefferson County, and we just worked our way through Mental Illness Awareness Week at the beginning of October and did a couple of things, including city and county proclamations in relation to that. NAMI Washington, of which we're an affiliate, is gearing up for the legislative session, of course, a day or two after the election. So we're optimistic that good work will continue. So we're all involved in that. So we're carrying on business as usual. We have support groups twice a month and offer classes also. So we'll keep you informed about those things.
Thank you, Patrick. Chief Olson.
Can you hear me on this one?
I sure can.
Yeah, I had to go to my phone. My headset died on me.
Oh.
And what was the question? Because I missed it.
We were just looking for introduction and any updates that you'd like to tell us about the police department.
Oh, I'm Chief Olson, Port Townsend Police. Really no major updates at this time.
Okay, good to have you here. Denise Baker.
Hi, I'm Denise Baker, Jefferson County Public Health Community Health Division Director, and updates. Well, we're happy to not be quite as busy with COVID. That's certainly true. You know, our mobile, our SEP team went out the other day to South County and to parks in Port Townsend with safe smoking supplies and also with naloxone. So, and had a lot of great interactions with folks in the park. So yeah.
Oh, great. Well, I'll look forward to hearing more about how all of that is working too at our South County meeting. That's Cherish Cronmiller.
Good afternoon, everyone. I'm Cherish Cronmiller, the Executive Director of Olympic Community Action Programs, your community action agency for Jefferson and Collin counties on the Olympic Peninsula. And, you know, making headway on our Seventh Haven project, still set for spring occupancy is the hope there. And looks like we will be moving our Caswell Brown Village folks. So, we've been operating in an emergency area. It's just been the folks from the fairgrounds, essentially. That's all we had room for in the emergency space. We're moving down to the permanent space, the phase 2 space. Next week is when we will be moving the current residents over. So we need to get that situated, get them situated in order. And then hopefully by the end of this month, we'll be looking at moving in and filling the additional slots that we will have there for the additional folks. And so Robin Pangbor, our shelter manager, will be having a meeting with some of our partners and some of the housing advocates talking about, what the current rules are based on the residents and our insurance and the ordinances, and see who's going to be viable options for moving in there, with obviously wanting to put families at priority if necessary. So that's probably the biggest one right now. And Community Build is working hard to ensure that the folks that are currently in tents are going to be in wooden structures instead of those tents as we go into the colder months. So yeah.
Great. Thank you, Cherish. Chief Black.
Sorry, you caught me without my finger on the mouse. Brett Black, East Jefferson and Port Ludlow Fire, and we had the results from the election the other night that were favorable for both districts to merge, or Port Ludlow to merge into East Jefferson. But it doesn't become certified until the 29th, but it was, I think it was 87% in favor, so that's pretty high, which will mean we have approximately 55 operational personnel between both agencies, which will be great to be able to move them around more fluidly, if that's a real word, for surge incidents, which we had over the last weekend with the Stormageddon. For some peak demand challenges we had, the city was pretty much in the middle of a hurricane, but the south part of the district in Port Ludlow was relatively calm, so we had to shift resources to help out Port Townsend. And then Sunday, it was the opposite, where we had a CPR call, another medical call, and a structure fire in Port Ludlow. So we had to move everybody from East Jefferson down to the south part of the two districts, which happens a lot both ways. So and then tonight we have a special board meeting at 6 p.m. to hopefully accept our strategic plan and standards of cover, which is the first time we've ever had that. And it's a pretty big deal for us. A lot of our county and city partners were part of the stakeholder groups, maybe some of you as well. We're pretty excited and pretty proud of the product, and it points us to some things that we need to improve as well, and relevant to this conversation. So thank you.
Well, it sounds like congratulations and kudos are due across the board there. Good to have you here. Lindsay.
Hi, can everyone hear me?
Yes.
Sorry about that. I'm using these headphones, which, I might take off to the moon with these on. But yeah, happy to see you all. Thanks for inviting me today. And my name is Lindsay, and I am the coordinator of the Community Prevention and Wellness Initiative in the Port Townsend School District. So we just, in general, do adolescent substance prevention. And some updates I could say include Guiding Good Choices, which is in progress. It's a workshop for parents of youth age 9 to 14. And additionally, something I'm really interested in connecting with Lori and Anya about, I'm working right now with a group of students from the University of Washington, and I'm interested in connecting with you all based on what I read in the packet for today around the project around Narcan stigma, harm reduction, and local bar employees. It kind of aligns with how we had defined a scope around a project that I'm working on with them until mid-December, just to make sure, I'd love to collaborate, and then also make sure that we're not, duplicating or interfering with anything that's going on. But yeah, love to connect next week after the holiday, and great to see you all. Thanks.
Thank you. Yeah, that sounds good. We'll get something set up. I always appreciate having this table so that we can make sure that that sort of thing is clear. We're not stepping on each other's toes. Apple.
Good afternoon, everybody. I'm Apple Martine. I am the director at Jefferson County Public Health. Nice to see everybody. A few faces I don't know, but most everybody I do. Some updates from me. I think Denise kind of captured it well in terms of sort of our engagement around behavioral health issues and things that are going on here. I'm trying to think of what else might elaborate on that. I think we're developing our harm reduction strategies internally in Jefferson County Public Health's clinical services in some new and innovative ways. Obviously, Denise shared with you that we're doing a little bit of outreach differently than we have in the past. We have safe smoking supplies that are kind of coming online in terms of necessity because our syringe exchange program has had a reduction in folks coming in to exchange needles. And that could be from many things because we've often seen some vacillation in terms of folks coming in. But right now, what we're hearing is that people are using less needles and more smoking in terms of what's happening on streets. So I wanted to put out there that I think 2 months ago, I had mentioned that Dr. Berry, our health officer for both Clallam and Jefferson, would be doing a presentation to the Board of Health about harm reduction concepts and educating the board around that, but also kind of updating them on some of the trends that are changing and some of the ways that we and many people at this table are kind of adapting to those changes. That particular topic was actually twice subverted because of other immediate actions that the board needed to take about other topics. So Dr. Berry will actually be first on the docket for next Thursday, our local Board of Health meeting, and she will be giving that presentation finally. 3's a charm, right? So I think with that, I'll just pass it on to the next person. Thanks for inviting me, and it's good to see everybody.
Thank you. And Apple, we can, after that is done, get a link that links to the exact spot in the Board of Health where that is, if anybody wants to go see it, make sure that gets out in the notes. Jolene.
Good afternoon, Jolene Crone, Deputy Administrator Clinical Director with the Salish Behavioral Health Administrative Services Organization. I think our biggest update is we do have a new staff starting on the 21st, and he will be heading up the move towards the Behavioral Health Youth Navigator program that will serve youth and families across all 3 counties in a multidisciplinary team fashion to coordinate care better, particularly for with a priority on youth who are in emergency departments.
Great. Thank you. Good to see you. Jim Novelli.
Jim Novelli, Executive Director, Discovery Behavioral Healthcare. I don't know we have much different to report, but I know recently we've been working with Jefferson Healthcare with several different meetings to get better overall collaboration with some of our systems, especially our crisis work. I know Jolene's been part of those meetings with us, as well as Dr. Carbaum. I've been working with him to help educate, do a little more education with the Jefferson Healthcare staff and trying to coordinate. Really, the issue is we've had probably 3 different groups in Jefferson Healthcare that want to meet at different times. So I'm trying to get them all in the same room at one time, make it a little easier so the message is heard once, and they've heard that really well. And have a meeting scheduled this week to better coordinate our work together. So that's about it.
That sounds like good collaboration.
Yeah.
Did you say Anya?
I did.
Hi, I'm Anya. I'm a social worker and working with this behavioral health consortium on overdose education, prevention, and engagement. I have a slide later, so I'll be brief, but I did 2 events in October for East Jefferson Fire Rescue 150-year event. I got 53 boxes of naloxone out, and at the Med Take Back with the support of the Empowered Teens Coalition, we got 6 out in Quilcene and 6 out in Ludlow. And I've been in communication and collaboration with Ocean at the syringe exchange clinic, working on getting the fentanyl test strips and potentially going out with them and doing some more engagement and outreach with folks who are unhoused. So happy to be here, and I'll share more in a little bit.
Great. Thank you, Anya. Brian Richardson.
Hey everyone, Brian from Deaf House Recovery Cafe. What we've got going on, well, we've seen a lot of new faces lately. I've been very grateful for the real team. I'd like to give a shout out to the folks who have been coming by and yeah, literally showing up for our folks here, especially as it's been getting colder, making sure people have what they need has been great. We are still planning to open for meal service on Tuesdays coming January. We'll try to get through the holidays first, but we do need some help. So we have had a staff position open for a little while, basically direct recovery support services on the floor, as we call it. So if you know of anybody who'd be a good fit, send them my way. Thanks all.
Okay, thank you, Brian. Cassidy.
Hi, everyone. I'm Cassidy Chang. I'm the new population health coordinator over at Jefferson Healthcare. So I work with Dunia. And not much to update on, honestly, but we've been working on several of our portfolios, such as health equity, childcare, and we're starting a new one on climate change. And we are also working on a grant for improving dental access for youth and the elderly populations. So yeah, thanks.
That'll be exciting. Thank you, Cassidy. It's good to have you here. Lisa Ray Thomas.
Hi, everybody. Lisa Ray Thomas. Really great to see all of you and hear the great work you're doing. I'm with the UW Addictions, Drug and Alcohol Institute and also a consultant with the American Indian Health Commission of Washington State, who we just had the 4th out of 5 session in a series called Tribal Sovereignty in the Indian Healthcare System. The last one will be in January, and they're all recorded, so I'll put a link to that. It's been a really fabulous series. And I'm knitting a winter blanket for my 3.5-month-old grandson. And I'm going to go off camera for a bit to eat at a late lunch, but I'm right here.
Okay, great. Good to have you here. Matt. Can't tell if maybe Matt is unable to speak, so I'm going to skip over him, but we're glad he's listening. Thomas's, oh, that's Chief Olson's. And how about Adam York?
Hello. Been having headset trouble. I'm Adam York. I'm a data analyst at Jefferson Healthcare. I've been doing a lot of kind of back end work. It's not as flashy, but just still focusing on getting our infrastructure together to be able to automate data updates and things like that, so that our analysts have more time to answer new questions instead of maintaining the answers to old questions. So we're also doing some work with going into antibiotic utilization and stewardship and so population health and equity, doing diving back into equity here soon. I feel like I'm always diving back into equity. It's kind of like that. It's always a new spin on those questions. So yeah.
Well, I've missed your updates. It's good to have you here, Adam.
Yeah, thank you.
Okay, I'm going to share my screen. Get things situated so I can see everyone. Has the screen shown up yet?
It just says started for me.
Yeah.
Hold on 1 second while we. Bear with me. I'm sorry, guys, I'm frozen.
Only your screen is frozen. We can see you and hear you. And
okay, all right, I'm going to go with it. If you look at the meeting packet, which hopefully you guys can see the link that was put in the chat, we have for our agenda today. First, we're going to go over the reporting structure, which should take half spending.
Oh, no, you're cutting out, Lori. Do you want me to share your screen?
Yeah. Yes, if you can.
Yeah, I'll share my screen with the agenda and everything on it with the links to everything.
Oh, that's perfect.
Okay, so do I have permission?
I can't do anything because I'm hung up on this end.
Okay, let me see if I can share my screen.
Also, Lori, while she does that, you could log out and
Oh,
log back
right.
in.
I
Maybe that would
can't
help.
share my screen yet because you're still sharing yours.
Okay. Sorry, guys, I'm gonna see if I can go out and come back in, and if I lose you all, log into the same link again.
Okay,
Okay,
our pleasure.